Hello and welcome to CSN News. Today's topic will be talking about the dangers of salmonella and ways of preventing disease. We will be covering what the disease is about, how it's passed, and the signs and symptoms, and of course the possible treatments available for the disease. And now to you, Sua.
First off, what is Salmonella? Salmonella is a bacterial disease that affects the intestinal tract through person-to-person or animal-to-person contamination. Most frequently through contaminated water or food, the ingestion of any organism that is contaminated or improperly cooked is the common mode of transmission of the bacteria. The foodborne transmission occurs when raw and undercooked eggs, egg product, meat, and poultry is digested without any prior proper care and attention to food preparation. Moving along, where is this pathogen found, and what are the signs and symptoms that you should look out for? Back to you, Irene.
Thank you, Sua. The improper treatment of food starts even before the product arrives at your homes. Food may come into contact with feces during the butchering process, risking contamination. Salmonella is the most common in developing countries but also frequently occurs in Europe, Asia, and Latin America to the Caribbean. In the U.S. annually, Salmonella causes 1.2 million illnesses, 23,000 hospitalizations, and 450 deaths in the U.S. However, the estimated 1 in 20 eggs that are thought to be contaminated has a low risk of infection. If you're still worried about getting a disease, some signs and symptoms that you should look out for are nausea, vomiting, diarrhea, and abdominal cramps. Some cases result in typhoid fever, but these are only common in developing countries and is not common in the US. Now we will look into how salmonella can be treated and if there is any vaccines towards it. Over to you, Sua.
As for the treatment, the short answer is yes. Salmonella infection can be detected by testing a sample of your stool, and treatment is possible through fluids and antibiotics. Prevention methods are possible by avoiding raw or undercooked meat and eggs and ensuring that raw meat is handled separately from other food when preparing a meal. When cooking, wash your hands, cutting boards, utensils, and countertops before and after handling different kinds of food. Properly washing not just the fresh fruit and vegetables, but also the meat and poultry are critical to keeping a sanitary workspace. It is recommended to store goods at the correct temperature according to their food group. Keeping the refrigerator below 40 degrees and putting prepared food in the fridge within 30 minutes after eating are just some of the easy ways of preventing a salmonella infection. Always make sure to keep hot foods hot and cold foods cold.
Although there is no vaccine to prevent infection, simple proper care can avoid salmonella and a costly hospital bill.
Thank you for your time, and I hope that this will help you and your family from contracting this bacterial disease. Thank you.